we talk about three pillars a lot. So that's palatability, scientific validation, clinical study, but also stability study. And the third would be simplicity or convenience of use. Our products are indeed liquid and very simple to use, very easy to integrate into your daily life.
Hello, everyone, and welcome to another episode of the Nutricosmetics 2030 show. I'm your host, Matitz Batagel, a marketing advisor at TOSLA Nutricosmetics. I'm joined here today with my regular co-host, Uroš Gotar, our CIO. And today, a very special guest, a member of the team of Uroš, our biochemist superstar, Dolores Hartig.
Thank you for having me.
Hi. Since I have this little sciencey team here today, I wanted to dive a little bit deeper into products. And one particular topic that I want to discuss is actually active ingredients. Because there is a lot of talk about active ingredients here, there, all the talk, but let's just start at the basics. Let's just start at the beginning. So, guys, I would like to know what active ingredients actually are.
Okay, sounds perfect to me. And I would like to explain what are active ingredients. They can be defined as compounds that give some product its specific purpose. They're there for some specific psychological therapeutic effect on the body. And the term active ingredients is used to distinguish those ingredients from other substances present in a product. Mm-hmm. So when we talk from Nutricosmetics perspective, active ingredients can be defined as substances that have a positive effect on the skin. They can be used for positive purposes regarding anti-aging. They can be used as, for example, for sun protection or acne treatment or others. At TOSLA, we carefully choose our ingredients because we want to focus on a product which has a positive effect coming from within. That means that our active ingredients are nutrients or bioactive compounds that have a positive effect on skin health, collagen production, collagen retention, hydration, and basically protect our skin from various environmental factors.
So can you give me some examples of, just so we understand a little bit better?
What some examples of active ingredients?
Yeah, exactly.
Of course, some basic active ingredients you are in contact to every day are vitamins and minerals.
Actually, and I want to ask you this question now, because sometimes I was little bit confused. What's the difference between vitamins and minerals? Because you always hear vitamins and minerals, all the time. You should take more vitamins and minerals. What's the actual difference?
Because you always hear them combined
together.
Yeah,
it's always the same. And it's okay, this and that. So what's the actual difference between vitamins?
Yeah, but they're actually different. Exactly. Yeah. I would say that easiest way to differ vitamins from minerals is that vitamins are organic compounds, while minerals are inorganic substances. Mm-hmm. Vitamins are present naturally, and they're naturally occurring in our body, while minerals are present in soil and water.
Mm-hmm. So we are not able to produce them on our own.
We are not able to produce minerals, okay. But some vitamins we are able to produce.
For instance, I think vitamin C, I don't know, is it an exception? Vitamin C cannot be produced
within our body. No, yeah. It cannot.
That's where you have scurvy. I don't know if you...
No, I don't know it. That's why I have got you guys here.
Scurvy is a disease that pirates have. They actually didn't eat citrus and fruits and vegetables, so they developed scurvy, which is a disease deficiency of collagen. Actually, the collagen is not formed in their body like it's supposed to, so they would their bones would break, their skin would peel off. It was terrible.
And as I understand, because they didn't get enough vitamin C,
Yeah.
because they were on the ships for too long and probably didn't have like the access to, like, I don't know,
Yeah.
oranges or
Correct.
whatever.
Correct.
That's a interesting story.
A bit of history.
Bit of history and pirate stories. Nice. Okay, so we have vitamins and minerals. What are some other groups of active ingredients here?
Well, collagen would be my obvious answer, right? So this is a protein. Then other active ingredients would be herbal extracts, amino acids, isoflavones, omega-3s, basically everything that has some kind of a positive effect on the body.
Okay. Formulations, however, are not like when you think about products. So basically, a product is when you take like different ingredients, put it together for like because you want some kind of an effect. But usually in the products, we don't have just active ingredients. What are the other things that go into a formulation?
These other things are also called excipients, although this term comes more from the pharmaceutical industry. But I guess you can call them inactive ingredients. So the most obvious one in our products is, of course, water. Also, it's like the biggest percentage by mass is water when you look at the products. Then you have additives. Here falls in sweeteners, flavors, preservatives, acids. That's right.
Let me stop you right here.
Yeah.
Could you consider water as an active ingredient because it helps with hydration, maybe?
In this context, I suppose, but you wouldn't buy a product, a supplement that has declared active ingredient water,
Yeah,
you know,
okay.
because you can buy water.
Yeah, just buy water.
Yeah.
Imagine like on a bottle of water, like active ingredient water, 100%.
Food supplement.
So, okay, you have a bunch of other ingredients beside active, but like what's the main purpose of this, like, let's say supporting like orchestra in the products?
So, like Uroš mentioned, we have acids, for example. We use them mainly to lower the pH of the product, keeping the product more stable, meaning that the low pH is preventing the growth of microorganisms. And besides that, the acids are used, for example, like citric acid or malic acid, to enhance the product's flavor.
So like a double role. One is like
double role. Yeah, exactly. Similar to the acids, for the flavor enhancement, we used as well sweeteners. With the sweeteners, you actually have a positive effect of not using sugars inside. So they're basically like a replacement as well. Then I would like to add that there are also present preservatives, which are there to, again, like acids, prevent the microbiological growth inside the product, allowing the product stability and consistency. And they are there basically to destroy the microorganisms inside.
Okay, can I stop you just for a moment? Because I know with the preservatives, there is a big debate. Uroš, is it possible to avoid preservatives, in your opinion, like completely?
In some cases, it's possible. For example, if you have a single dose shot, so it's intended to drink it in one take, right? Then it's possible to formulate a product without preservative. In this case, we would have to hot fill them. So the temperature of the filling in our filling line has to be around 85, so that the whole inside wall of the packaging is pasteurized and the microorganisms are killed in that way. On the other hand, in the products where you have like a multi-dosage kind of format, in these cases, the how should I say, the absence of preservatives is not possible because they indeed inhibit growth and prevent prevent microbiological spoilage, which would in fact change the product completely, because we know that during the fermentation process, the bacteria, the yeast eats the nutrients that are inside the product, and then they form gases from that. But on the other hand, also, if you consume this kind of product, you get like all these adverse effects. So this is a food safety concern, adding preservatives.
Yeah, so yeah, I guess it's like a big, also like not concern, but like you have to see it from the regulations point of view and all of that. And like, as I understand, it is possible to have a preservative-free product, but you have to consider like many things, how to put it together. And I would actually like to continue on this note, because like, yeah, okay, so we have different active ingredients. We have the, let's call it the supporting ingredients. But how do you actually, when you think about a new formulation, where do you start? How do you actually start thinking when you try to put something together? Where do you start?
Okay, so first thing we do when we want to produce another product, we want to make sure that we will know what is going to be the purpose of a product. And then we sit down and we do tons of researches about different active ingredients. Are they backed up with scientific researches, clinical studies possibly? And then we decide what could be the best formulation. And then we basically start with NPD.
So basically you start on paper, and then I guess you like start putting it together in the lab, right?
Yeah, from paper to the lab.
Yeah. All right.
Maybe one thing that I would mention, we also check the regulations. For example, some botanical extracts or some other active ingredients might have some regulatory limitations, so we need to pay attention also to that. But then, yeah, we take it to the lab. The research work is finished, and then we obtain the samples of these active ingredients. We mix them first in water in the portion that we would like to have. Like sometimes it's 15 ml, other times 25. And we see the taste first, and sometimes they would taste really awful, right?
Most of the time.
Yeah, it's I don't know why is it like that everything that is healthy tastes like that, but that's definitely.
I guess this is the thing. Like, it was like, you want to be healthy, it's not going to be an enjoyable,
that's
like,
right,
situation. But like, once I heard like this thing, like this question, like, did you ever try to put apart a capsule with like full of like vitamins and minerals and try to just take that? Like, it's really tastes awful.
Yeah,
so
exactly.
basically,
so that's what we're actually doing. We're taking that active ingredients, put it in water, tasting it, and then we have to define other ingredients, as we mentioned them before. So sweeteners, organic acids, preservatives don't need to go there at that point, but yeah, things like that. So we have to define and optimize the flavor, and this is a very tricky part, but it's also where the magic happens at TOSLA, because we're very experienced on that. For instance, if you have active ingredients that's very bitter, you want to work with that, not against it. So maybe you want to add grapefruit flavor, so you would enhance this flavor and get a rounded taste at the end.
Okay, so if I understand correctly, because like I was thinking, okay, we start, as Dolores said, with the purpose. So let's say you want some like a product that will help you with, like, I don't know, hair growth or whatever. So you wouldn't go and say, okay, what are the best ingredients to help with that? Just put it together and then just start testing right away if it works. As I understand, you try to look at it like quite holistically from the beginning. So basically you try to like also make it taste nice from the beginning, even just for like the test phase?
Yeah, we believe at TOSLA that if you want to form a habit, which you have to, if you want that product to be effective, it needs to be attractive, it needs to be enjoyable, it needs to be obvious. So the taste at TOSLA is paramount, and we need to pay very lot of attention.
Yeah, because I actually had a thought about the clinical studies, maybe because like the clinical study, even like if it's like made on real subjects and everything, it's still like kind of it's still like a test environment. Still people, they have to take it. It's not something that is like voluntary, and
somehow they're forced to take it. They even get compensated. They are obliged to write diary about it, and then they get well, it's not good if they don't do their daily routine.
Yeah, because like of course it works if you take it, but like what's really gonna happen in the real life? So this is like I guess like a very important thing. So right now I already see that like active ingredients are not the full story. So you really need a lot of things for the formulation to actually work, not just from the like efficacy standpoint, but also from the user experience standpoint. So I see this like it's kind of like putting a symphony together.
Yeah, we talk about 3 pillars a lot. So that's palatability, scientific validation, clinical study, but also stability study. And the third would be simplicity or convenience of use. Our products are indeed liquid and very simple to use, very easy to integrate into your daily life.
And I see now that like a lot of things they like has to go. And what I like is like how you actually start with the product development, that like from the beginning, like you really think how to put the things together.
Yeah, at the end of the day, all 3 things need to be checked. So if validation, the clinical proof, and the simplicity, so the liquid format, these 2 things is checked, but palatability is not. There's a very high probability that the product at the end of the day will not work because people will not enjoy it. Therefore, they will not use it for a long period.
So basically, you wouldn't, let's say, try to first think about the product that would be the best possible combination from the efficacy point of view and try to like figure out the palatability later. You would try to do everything kind of like at the same time, right? To really find this balance.
It's like
from the beginning.
like a dance. Like you have to pay attention to all of the 3 let's say USPs at the same time.
Okay, I would like to go on with a bit of a personal question for both of you. What are yours like most favorite like active ingredients? What do you like to? I know that like most of them taste awful. They're really hard to work with, but like which ones do you like the most?
You want to go first?
Yeah, gladly. Because from my point of view and from the lab's perspective, the best ingredient is the one that goes well with the formulation of the product. The one that can cooperate friendly with other ingredients, let's say. Because at the end of the day, I like to keep the normal level of vitamins and minerals in my body.
To me, I would say that collagen is my
obviously.
Yeah.
The collagen. Who's the collagen guy now?
Oh, I can tell you why as well. It's because it's the most studied, at least in my book. And I know how it will behave. I know what I can expect if I add some, I don't know, different ingredients. I know how to neutralize the taste and flavor very well. I know that it's very effective, and maybe last but not certainly not least, it's very effective. So since the beginning of my career, I'm looking how people are happy to repurchase the products containing collagen.
Okay, so still very high. Like I kind of knew the answer, but like when you explain it like that, I guess it's it's pretty obvious. Are there any active ingredients that you kind of like to avoid? We touched a little bit on the regulation before, stuff like this. Are those some that you really don't like to work with?
We test a lot, like every ingredient that you can possibly think of, we test it. But we have to check different things where before we formulate a product with this particular ingredient. It has to be water soluble. It has to be stable. It must not interact with other ingredients in a way that it would compromise the efficiency or something like that. You mentioned the regulatory prospect. I think I covered most of them, maybe all, but yeah, most of them.
Yeah, but not you don't have like a particular one
Like
that you hate because you love collagen, but
I
you
hate. I don't like omegas, I guess, although I take it myself because there was number of times that clients were asking for omegas, and I always have to be like, yeah, we cannot do omega.
Yeah, because they don't dissolve in water, right?
Oil and water, they do not mix well.
And this is actually like I was thinking about like omega-3s, omega-6. Like we all know that they're very important, but they're actually very hard to like. Basically, it's really a standalone product. Usually, the omega like supplements, you cannot put it in liquids, you cannot put it in powders, you cannot basically put it anywhere except like having it like in their own form. So yeah, I guess whoever is gonna like figure out how to put it in liquid is gonna be pretty rich.
There are some ways how to do it, but like you can put emulsifiers, which is another additive, and add water, and then you can get an emulsion. But still, at the end of the day, these two phases would separate, and to me, it's just not a mark of a very good product if like you have to shake it before you use and stuff like that.
Yeah, we're used to that at some products saying like if it separates, this is a normal like natural process, just shake it. But like again, this from a user experience standpoint, it's not like a very pleasant experience, I guess. Okay, now I wanna like take us into a little bit of a different direction. So all these things like putting it together, how it works together, what effect does it have? This is very then connected with basically with like what can you actually say about the product, how you communicate it, what claims can you make, like beauty, health claims, stuff like that. Can you talk a little bit more about that?
In our industry, you have something that is called health claims, and it's basically a list of claims that you can use, and they're tied to particular active ingredient like vitamins. Mostly it's vitamins and minerals, and it's very strict in terms of you have to say exactly what it says in that list. For example, for vitamin C, you would have it contributes to normal collagen formation for normal function of the skin, something like that. So you have this list. But on the other note, you cannot say anything else, even though if there was a clinical study done on a particular ingredient, you're not allowed to say that on the label if it's a health effect.
So it's a very strict kind of regulation here. Even if you figure out the combination of two active ingredients would have a health effect, you are like, when would you be able to say it? Is this like you make a study on it and then like you hope that you're going to put it on the list, or how does this work?
Well, I don't feel competent enough to answer this question. Maybe we'll do that episode with some regulatory expert, but I think that the process is like this. You have to apply to probably EFSA that you want this kind of claim, and then you would have to substantiate it with a lot of data. I don't think that clinical study alone would be sufficient. Yeah. But then on another note, you have something that are beauty claims. This is somewhat more a gray area, I say, because they're not as regulated as health claims. And as the name implies, they're related to beauty. So, for example, it makes your skin less wrinkly or something like in that context. These kind of claims are regulated post-market as opposed to health claims. Health claims are pre-approved, and you can pick them and basically use them. But with beauty claims is another story. You don't have a list. You don't have a pre-market authorization of these claims. You have only you can rely on clinical studies, on established data and so on, but the regulation is a bit lacking on this matter. And you could get challenged if you put a beauty claim on your product and then you don't have a clinical study to back it.
So as I understand, with the health claims, like the things are pretty strict, but on the other hand, you know what you can do, right? Mm-hmm. And with beauty claims, it is a little bit more liberal, not so regulated, but basically you don't know until where you can go with that either. So yeah, I guess also, do you study, like for instance, when you're developing a new formulation, do you basically approach it from this standpoint also, like what could be claimed about the new product?
Yeah, certainly. I mean, we go back to the clinical study, to the published literature. For example, if we see that a typical ingredient has a certain effect on skin, for instance, then we think about what kind of claim could we sustain.
Yeah, basically, what claim could be also offered in advance. So another thing that you have to think about when you're putting a formulation together. Okay, guys, I think we have to wrap up this episode slowly. So my last question is there an ingredient or something that you are working on in the lab that you are like super excited about at the moment? Could be whatever.
Well, actually, there is something I'm actually currently working on in the laboratory. It's not an ingredient, but it is a product. All right. We are actually proud of that product. Uroš and I started it this year, and it is mainly focused on something different rather than collagen just. All right. And it is supposed to target your hair health.
Okay, so basically trying to open like another story here.
Yeah, you can put it that way.
Yeah, I heard a little bit about it, but I guess I don't know how much information you can give right now, but like very exciting. Nice. Uroš, is that the most exciting thing for you too at the moment?
It's one of the most exciting things. There are a lot of exciting things happening right now, but for me, it's not the most one. The most one for me would be, it's not tied to a product or ingredient, but actually to the artificial intelligence everybody is talking about. We are figuring out how to leverage this new era, this new technology, on how to optimize the flavors of our products even further.
Okay, nice. I can't wait for both the products and the evolvement of the technology. I guess the products will be even better with all that. And at this point, guys, thank you for another super informative episode. I always learn a lot, so I kind of I'm becoming a Nutricosmetics expert. So maybe I'll also do like some solo episodes from now on.
We can then take some time in the lab, like
to actually do something, not just talk about it.
Yeah.